As my president, president of the Ghana Medical Association, Dr. Frank Sherbo, said not too long ago, the biggest reason for which people are leaving, all professionals in general, and then doctors are leaving, is mainly economical. In the sense that their purchasing power in the market has reduced over a long time. And so, besides the example where, despite the best efforts of governments over the years, including this government that has made some good efforts to try to improve conditions of service, you actually, in terms of buying power, in dollar terms, for example, having worked for long, and improvements in your salary in nominal terms have actually worse off in terms of what you can afford to buy with that money. I remember during house job time, when we had just left house job, Mercedes C-Class used to be called pure water, because generally when your back pay comes, with a little bit in addition, or even with that, you should be able to purchase a C-Class. Some people were able to purchase CRVs and co and that. Now, it is difficult because your salary converted to dollar terms, you are even worse off then, because that is the reality. And so, the general economic situation is a big disincentive, because no matter how much you earn, the general average doctor cannot walk to a showroom to even buy a car, let alone go and purchase a house off. And so many people are asking themselves those questions, that after serving this country, after working all this while, what do I gain? How do I go home? If my salary cannot take me home, how do I go home? And that is the main incentive. Of course, admittedly, it is difficult for us to compete with the countries where people are migrating to. However, if we were able to put certain key measures in place, especially things that take care of the recurrent costs that workers face, like healthcare, many healthcare workers would have to actually pay for their own healthcare in sometimes the hospitals they even operate. Sometimes the Ghana Medical Association has had to jump in. Of course, sometimes we even call on government when the costs are high. And so those are important discussions we must have, and like we are having rightly so now. So some of the measures Dr. Nsiah-Sarrey has mentioned are things that have also been on the table for long. For example, the rural incentive package, beyond allowances, included many other things that we felt will motivate people, especially those staying and going to the rural areas. Because if you get these people to stay long enough, some may get married and may not want to go out again. Some may establish businesses and may not want to leave again. Some may at least serve for a period before they think about leaving. However, this implementation of this, which has gone ahead, a team has worked on it, costed it and all that, has been stuck at cabinet for quite a long time. Of course, we have pushed that some aspects of it, the non-financial aspects of it, like promotions out of 10, sponsorship for postgraduates and other trainings, various other non-financial aspects of it, we've pushed that those ones should be done. There are some efforts and attempts to implement same. However, we realize that it's also not across board. The issue about residency is an issue that is very important, and of course some efforts have been made in this regard. School fees is no more. And again, where people are supposed to be released early enough to leave for school, specialized, and they then often stay. And so these are some of the things that we have spoken about, and I think Dr. Nsiah-Sarrey have also spoken about, but we think the implementation of same has delayed. But the major underlying thing here is the fact that the general economic situation is such that the salaries cannot take you home.